If you're thinking about having liposuction, with modern techniques you can take out a whole lot of fat. But did you ever think about what happens to the skin afterwards? That's why you need the laser. With the invention of tumescent liposuction in 1987, liposuction's become nearly bloodless, painless, and you can do a whole lot more. We fill the area with a dilute solution of local anesthetic, which clamps down the little blood vessels so we get out almost no blood. It makes the area numb, and you can even do many of these procedures under local without having general anesthesia. Some people prefer to go to sleep with a light general, but in many cases it's not necessary if the patient doesn't want it. You can also take a whole lot more fat safely. Picture 2.5 2-liter bottles of diet soda. That's a lot of volume. That's how much fat you can safely take now. But did you ever think about what happens to the skin when you take out that much fat? That's why you need the laser. There are two important advantages to having laser liposuction: smoother contours and tightening of the skin. People that are doing liposuction without using the laser are doing absolutely nothing to address the extra skin that's left over when you remove the fat. It's much more common to see creases, wrinkles, and folds, whereas with laser liposuction, it's much less likely because you're helping that skin tighten. The second advantage to laser liposuction is smoother contours. The original liposuction used very large cannulas or tubes to suck out the fat. You often saw contours that were uneven at the end of the procedure and once the swelling went down. Then we went to smaller cannulas to allow for better control, and from there, PAL, power-assisted liposuction. In PAL, a machine vibrates the cannulas in tiny strokes to help to make the contours even more even. But in laser liposuction, we're able to melt the fat in a very controlled fashion, and you can see what you're melting as you go. So it's much easier to make much smoother contours, and you can do the procedure through little tiny incisions because you're not using large cannulas anymore, but very small fibers in which the laser energy passes into the fat to melt it. The same fiber then heats the skin to help to get tightening of the skin. So with laser liposuction, it's less traumatic. You use smaller incisions, you get better contours and tightening of the skin. It's better all around. So how does laser liposuction work? And what about ultrasonic liposuction? The concept behind laser liposuction is pretty simple. When you crack an egg and you put it on a cold skillet, it runs all over the place. But as soon as you turn up the heat, it shrinks to form an omelet. Heat contracts proteins. And it was felt that if we heated the skin, we could help the skin to contract just like that omelet. In the early attempts at ultrasonic liposuction, large cannulas were used to suck out the fat, and ultrasonic rods passed through those incisions to heat the undersurface of the skin to try to get that contracture. The ultrasonic energy, though, wasn't as controllable as the researchers needed, and they saw burns at the incision sites and fluid collections or little blisters under the skin, and the procedure was quickly abandoned. In the 1980s, lasers began to appear in plastic surgery with facial resurfacing for wrinkles and acne scars and tightening of the face. It was felt that maybe the laser would allow for safe tightening of the skin with liposuction. So the early attempts were done in a similar fashion to the way we did the faces, and it was quickly discovered that the face skin is very different than the body skin. And when you did that type of laser resurfacing to body skin, instead of tightening, it would make the same burns that we saw with ultrasonic liposuction, and the procedure was abandoned. But it was then discovered that if you heated the skin only to about 72 degrees centigrade or 160 degrees Fahrenheit, while you saw no tightening at all, the skin would think that it was damaged and start to heal. And it would heal or tighten over about 13 months. And that's not a guess. There was a great study in which a doctor made 2 little India ink dot tattoos in front of some people's ears and lasered the area, and found that those dots got closer and closer together over 13 months. So with laser liposuction now, you see immediate results as far as the removal of the fat. You don't see all of it for about 6 months because some of it is masked by swelling, but there's a very big difference right at the end of the procedure. But the skin tightening, it's not like, "Doc, you didn't laser me enough, you should have lasered me more." You laser to the correct temperature, the machine goes beep, 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 and you stop. And at that point, the tightening starts and proceeds over 13 months. So it's about 13 months until you see the final result of how tight that skin is going to be. In any event, whether you get all the tightening you want or not, it's certainly a much better procedure than traditional liposuction because you've done something to help that skin tighten. There are multiple types of laser liposuction, and I think you should understand the difference to pick the best one. Some companies make machines that don't actually measure the temperature of the skin's undersurface. Instead, they have the doctor calculate the weight of the patient, the surface area they're going to treat, and tell the doctor how much laser energy to put into the area. The problem with that is some people are always cold because they have bad circulation. Some people are always hot because they have great circulation, and you're not taking that into account. So you're guessing to some extent as to what temperature you're ending up at. Smart Lipo Triplex, on the other hand, not only has multiple wavelengths of laser energy to help with the skin and the fat separately, but has a device in the cannula that actually measures the temperature of the undersurface of the skin, allowing you to know when you're at the exact perfect temperature. To me, this is the safest way to do it, and I found it to give the best results. So Smart Lipo Triplex is the only machine that I would use. Where can you do laser liposuction? Virtually anywhere you're doing liposuction. There's always an advantage to helping to tighten the skin when you've removed the extra fat. The end result will be better than just leaving that extra skin alone. What about pain and recovery? Since we're doing tumescent anesthesia, which means we're putting a large volume of dilute local anesthetic into the area, people that decide to have the procedure awake feel almost nothing at all. If someone decides to have anesthesia and go to sleep, you need very little medicine to stay asleep because you're not having any pain during the procedure. People wake up numb for quite a long time, and so while many people will take pain medicine the night of the procedure, by the next day, most find they don't need it at all. There are no large incisions and no sutures to remove, so most people are back to work in the gym in just a matter of days. While we used to use compression garments to help the end result, it was found that with the laser, the compression garments don't help the end result at all. The laser tightens the skin. Some people find the compression garments make them feel better for a week or a month or so after the procedure. That's very independent. Some people like it, some people don't. So there's no question in my mind that laser liposuction is the best way to go. To me, it just doesn't make sense to do nothing to help the extra skin left over when you've removed the fat. And I think that Smart Lipo Triplex is the best of the lasers because you're actually measuring and getting to the perfect temperature at the end of the procedure. For more information, see my website at drstudin.com. There are also before and after pictures there. Don't forget to hit subscribe so you'll know when more videos are available on this channel, and I hope I've helped you.